And you're seeing it firsthand. You're seeing it. And when your kidneys break loose, Lisa, I think I brought this up in the video yesterday. You said whenever I drink this coconut water and grapefruit juice, you didn't say Thai, my heart goes off rhythm. I said to you that sounds like a neurotoxin. That's scary. I think you get your own coconuts and stuff, and make your own get your own juices out of there. I don't trust anything like that. Sounds like a neurotoxin there. And I did mention to you that combining coconut and grapefruit might create some gas. That could be a gas, but shouldn't throw you off rhythm like that. That sounds like more like a neurotoxin. But for someone to throw you off rhythm like that, that's a neurotoxic effect. But it also shows that how vulnerable you are to neurotoxins. So again, go after the adrenals and build that up. This is one I wanted to yes. This is always in the now. And I wanted to talk to you about her, and I wanted to talk to her about her. And she sent me a picture of her eyes. Is this your name on the back? Sat Darshan. I remember Darshan Singh. I remember, but this is a picture of her eyes. Now, she gives me permission to talk about herself, so I'm going to talk about you, honey. Here's a bit of her history. She was a healthy baby for 9 months, and then developed tonsillitis for the first time. About a month or two later, and after another tonsillitis, which was treated with antibiotics, I had a seizure and almost died. Well, that's not good. After that, I had tonsils frequently till my tonsils were removed before I turned 3 years old. Now, you can go back to the colon and to the lymph system with this, obviously. And let's look. I haven't looked. I've only, kind of looked at your eyes like this. I haven't even looked at them, so I thought I would wait and look at them on YouTube. We're given lots of antibiotics and vaccines as a young age. Move those lymphs. And I look at your eyes. You got a lot of lymph. You got to move those lymphs, honey. This eye was very dark. Hard for me to see whoever took these pictures. It's a good picture. They need more light. They need to change their armature, because you see how dark that picture is. Let me show you mine here. See the difference? Mine's a lot lighter. Here's not enough light in this. The picture's up close enough, but there's not enough light in there for me to really, this is really great because I can really see. But I can see enough. Now, I had scoliosis from age 5. Okay, so right here, let's stop right here, guys. We got tonsillitis all the time. Now, we've got scoliosis, so we know there's something in this area that affects the skeletal system, isn't there? What's in the throat area affects the skeletal system. Right on. I tell you, I've met with a lot of you guys. Man, are you getting this. I'm telling you, you guys know things no one else does. Yes, parathyroid gland. Not utilizing calcium properly. And of course, with the tonsillitis, you know, sweetheart, your lymph was backed up. And so now your back's pulling to the stronger side. Let me see here. Okay. If I look at your back here, I have upper neck. I have C-spine issues on the left side. A lot of lymph stagnation till I get to the lower back, and then I see the lower back, particularly the lower T-spine and then the upper L-spine. Definitely kidney. This is the right side. Excuse me. Heavy up in the. I'm going to say. The whole T-spine is involved on the right side. On the left side, just a little bit of the T-spine, but the upper C-spine. Lower spine on the left side, a little bit on the right side as well. Definitely kidneys are at issue here. You got to clean your kidneys, sweetheart. I don't know which kidney's weaker, the right or the left, because they both are involved. The right side encompasses your right leg. And that also picks up the knee and the upper femur, not moving your lymph well out of your groin or your right leg. You see a little groin weakness there. See if it'll help me with a little clarity here. Yeah, there's a tad bit of course, the right hip is going to be involved. You're going to feel that coming. And I think there's a tad bit of pancreatic issues involved here. The right arm could be stronger. Getting up into the upper right chest area up here, definitely got to clean this, get this axillary lymph bed cleaned, to get this breast cleaned up and strengthened up a little bit. Real important to do that. And I go back to the skeletal system. I go up to the parathyroid, definitely some genetics, not real bad, definitely some genetics. But what controls the thyroid and parathyroid? Matter of fact, what controls all the endocrine glands? The CEO gland, the master gland, the pituitary, and yes, I do see some there. When I get up into your right ear, cerebellum, actually the mastoid here and the ear, definitely some good genetics there. Could affect equilibrium, dizziness, stuff like that. If you got up too fast, maybe. Am I working myself down to this shoulder? Got a weakness in the shoulder, and then into these bronchial trunks here. Got to clean them out a little bit. With this bowel area here, you have some pocketed areas here in the bowel. Slight bit of prolapses here. Not bad. I mean, you got some minor thyroid. Clean that lymph out of that thyroid, by the way, and your sinuses in the head area. Around your bowel wall, I don't know if you can see this. I don't know if you can see this, but there's this ropey line here around the bowel wall, and that is your interstitial lymphatic constipation. No question you're malabsorbed. You really see it here. So you want to see a lot of this mucus coming out of the stools here. Yes, that orangish hint there around is sulfa drugs. Not heavy, but certainly in the, and trapped in the bowel wall here. So it's going to cause some inflammation. Over here in this splenic flexure here, you're really prolapsed down here, or spastic in that splenic flexure, and it gives a weakness that's spreading up into this mastoid ear area. And so that has to be fixed up. And a ballooning in your transverse bowel right about here. It's swollen up a little bit. But you have some parathyroid issues, I think, and so you have a little connective tissue weakness, and so things tend to herniate when pressure or impactions exist there. You know, same thing going on here, basically. You had a fair amount of lymph to deal with. Sinuses. I think left side of, you probably, I mean, they're almost the same, but this left side frontal, this whole area, a lot of lymph, a lot of sinuses have to clean out of there, sweetheart, and you'll be good to go there. I get down to the left kidney, adrenals, yes, rectal, yes. Now, I'm going to be real open because you said I could do this on this thing. On the female area, I would douche with the Heal-All-T. I think most of you females should work with that Heal-All-T and to spend a couple of weeks and douche with them. This will help to strengthen the vaginal walls and really clean that. Of course, you're going through the kidneys there lymphatically, but you really need to strengthen up certain female parts and the uterus as well here, honey. Female reproductive form would probably be good, but move those lymphs. Douching with Heal-All-T for a couple of weeks would be right spot on. Picking up again a little bladder weakness on the left bladder wall here, and then a little lower back that goes back to the kidneys here. Pretty good up the back here on the left side till I get up and a little in the T-spine, then get up in the C-spine up here on the left side, and then we're more involved there. But good strong genes. Now, it seems like a lot when I read all that, but I'm just going over her body. Actually, she's got good genes. She's got strong fibers, pretty good here. A few crypts, lacunas, stuff like that. Not a lot. But basically, bronchioles, lungs need to be cleaned out. Get the kidneys going. Get the GI tract cleaned up. Get the parathyroid up and cooking, because I see the same thing, thyroid, parathyroid on the left side here. See some congestion in the throat yet, so could have a little bit of a sore throat, that sort of thing. But good strong body here, sweetheart. Just got to clean up those bowels a little bit, you know, get that lymph moving, get those kidneys filtering, the adrenals up, and everything else will mend quite well because you're very well. Skin could be stronger and filtering better, no question, but you know, down on the thyroid a little bit, and you'll be good there, sweetheart. Now, big-time thyroid, parathyroid, right? Right on, sweetheart. You picked it right up. Good for you. See, I love you guys. You're really getting it. This is what we need the future to be. Informed, smart, and people hitting it. Irregular periods except for between age 20 and 30, which I was on birth control, da-da-da-da-da. Yes, exactly right. Pituitary issues. I see that in your eyes, and you picked it right up. Oh, my God, you guys are... I'm done. You guys come here, run my office for me, because you guys are good. Low blood pressure, weak adrenals, get those up there, of course. The eyes, that's about classic there. Often fainted during my primary school years. Holy crap! And taking iron tablets. Yeah, a lot of medical doctors give toxic iron tablets. Be careful. Bad news bears. But it never got corrected. But I know why. Adrenaline issues. You guys are smart, sweetheart. You're hitting your own self right on. Always in the now. Beautiful. Through this was very measured on my left arm, and now after a couple of months on your herbs, it's left 122/75, right 124/73. Great blood pressure. At least you're up in the 120s. That's textbook. That's perfect. You're building your adrenals up. I love it. Your diastolic, pretty good. You don't want it over 75, really, so you're right there at the max. You might even come down a little bit as you go along here. Eaten heavy meat, dairy diet for 18 years, then became vegetarian, but here's more proof of acidosis and not moving lymph, acne, dandruff, difficult sweating, ulcers in mouth. Right on. The acne, dandruff, you know, moving out of here, you show up here, you know, your whole head area needs to drain lymphatically. The bowels are giving a little bit of a block for you. You got to clean up this to get this to clean up, actually. But doing that, you're going down that road. Excellent. Difficulty sweating, that's a low thyroid there. Not enough body temperature to sweat. Ulcers in the mouth, way too acidic. Right on, dear one. Undigested food in the stool. Have been taking my temperature for the last month, which is on the herbs, and it's been moving between 96.6 and 97.8. Mwah. Well, that's what you want. You don't want to be below 97. Actually, you don't want to be below 97.5 if you can help it, but at least in the low 97s would be preferable. 97.8, textbook, perfect. But 96.6 very much on the low side. Now keep in mind, if you're checking your basals, every once in a while you're going to have a dump day. You're going to have a dump day in your blood pressures. You're going to have a dump day in your basal temperatures. Every organ takes a day and says, look, I need a break. And it's just what you see. And it's just like, okay, take a break today. And let me see. I've been taking my temperature, capsule lymph, Calma Plus, thyroid. Unfortunately, they confused the thyroid complex at the border. Confiscated.